Hello guys, welcome back to our channel. And in today's episode, we are going to talk about menstrual cramps, what it is, causes, natural cures, and home remedies, and even how to prevent it or management and treatment. So, feel most welcome and let's learn together. So, what is or are menstrual cramps? So, dysmenorrhea is the medical term for pain with your period, that is menstruation or menstrual cramps. So there are two types of dysmenorrhea, primary and secondary. And primary dysmenorrhea is the name for common menstrual cramps that come back over and over again. That means it reoccurs and aren't due to other diseases. And the pain usually begins 1 or 2 days before you get your period or when bleeding actually starts. So you may feel pain raging from mild to severe in your lower abdomen, back, or even thighs. So pain can typically last 12 to 72 hours, and you might have other symptoms such as nausea and vomiting, fatigue, and even diarrhea. So common menstrual cramps may become less painful as you get older and may stop entirely if you have a baby. So if you have painful periods because of a disorder or an infection in your female reproductive organs, it is called secondary dysmenorrhea. So pain from secondary dysmenorrhea usually begins earlier in the menstrual cycle and lasts longer than the common menstrual cramps. So you usually don't have nausea, vomiting, fatigue, neither diarrhea. So, what are the symptoms and causes of menstrual cramps? So, what causes painful menstrual cramps? Menstrual cramps happen when a chemical called prostaglandin makes the uterus contract or tighten up. The uterus, the muscular organ where a baby grows, contracts throughout your menstrual cycle, and during menstruation the uterus contracts more strongly. So if the uterus contracts too strongly, it can press against nearby blood vessels, cutting off the supply of oxygen to muscle tissue, and you feel pain when part of the muscle briefly loses its supply of oxygen. So, how does secondary dysmenorrhea cause menstrual cramps? So, menstrual pain from secondary dysmenorrhea is as a result of problems with the reproductive organs, and the conditions that can cause cramping include endometriosis. That is a condition in which the tissue lining the uterus, the endometrium, is found outside the uterus because these pieces of tissue bleed during a period. They can cause swelling, scarring, and pain. And the second cause of cramping at secondary dysmenorrhea is what we call the second one is what we call adenomyosis. So this is a condition where the lining of the uterus grows into the muscles of the uterus, and this condition can cause the uterus to get much bigger than it should be, along with abnormal bleeding and pain. And the third one is what we call pelvic inflammatory disease, that is PID, an infection caused by bacteria that starts in the uterus and can spread to the other reproductive organs. So PID, pelvic inflammatory disease, can cause pain in the stomach and pain also during sex. We also have what we call cervical stenosis, narrowing of the cervix or the opening of the uterus. And lastly, we also have fibroids, the benign tumors, the growths on the inside, outside, or on the walls of the uterus. So after that, what are the symptoms of menstrual cramps? So if you have painful periods, you may have what we call aching pain in the abdomen. That pain may be severe at times, feeling of pressure in the abdomen, pain in the hips, lower back, and inner thighs. How can you tell if the pain of your menstrual cramps is normal? What are the diagnoses and tests? So, if you have severe or unusual menstrual cramps or cramps that last for more than 2 or 3 days, contact your healthcare provider. Both primary and secondary menstrual cramps can be treated, so it is important to get checked first. So, first, You will be checked to describe your symptoms and menstrual cycles. Your healthcare provider will also perform what we call pelvic exam, and during this exam, your provider inserts a speculum, that is an instrument that lets the provider see the inside of the vagina, and the provider is able to examine your vagina, cervix, and uterus, and then the doctor will feel for any lumps or changes. So they may take a small sample of vaginal fluid for testing. So if your provider thinks you may have secondary dysmenorrhea, you may need additional tests such as an ultrasound or a laparoscopy, and if those tests indicate a medical problem, your health care provider will discuss treatments further. So if you use tampons and develop the following symptoms, get medical help right away, because over 102 degrees Fahrenheit is not normal. If you have fever and vomiting, diarrhea, dizziness, fainting, or near fainting, a rash that looks like a sunburn, these symptoms are of toxic shock syndrome, a life-threatening illness. So what about management and treatment of menstrual cramps? How can you relieve mild menstrual cramps? So to relieve mild menstrual cramps, first, the best relief, take ibuprofen as soon as bleeding or cramping starts. So ibuprofen belongs to a class of drugs called non-steroidal anti-inflammatory drugs, that is NSAIDs. They reduce the output of prostaglandins. If you take these non-steroidal anti-inflammatory drugs, you can take another pain reliever like this one called acetaminophen. So please, you can also place a heating pad or a hot water bottle on your lower back or abdomen. Rest when needed. Avoid food that contain caffeine. Avoid smoking and drinking alcohol. Massage your lower back and abdomen. And women who exercise regularly often have less menstrual cramps. So to help prevent cramps, make exercise a part of your weekly routine. And in case all these steps I've mentioned doesn't work for you or relieve pain, your healthcare provider can help you by ordering medications for you, including ibuprofen and another anti-inflammatory medication in a higher dose that is available over the counter. So your healthcare provider might also suggest oral contraceptives, since women who take oral contraceptives tend to have less menstrual pain. So if testing shows that you have secondary dysmenorrhea, your provider will discuss treatments of the condition causing the pain, and this might mean oral contraceptives, other types of medication, or surgery. What about the alternative therapies? What types of alternative therapies might help with menstrual cramping? So, women who have painful periods often try to find natural ways of dealing with the pain, and studies on alternative or complementary methods have not been conclusive about results. So, remember that most supplements are not regulated by the FDA, and other methods you might find useful include yoga, massage, relaxation, or breathing exercises, acupuncture, and acupressure. So, what can you do to prevent? Can you prevent menstrual cramps? The answer is probably not. However, eating a balanced diet and getting regular exercise may help stop cramps from being intense. Living with it. When should you contact your healthcare provider about menstrual cramps? So, bad cramps keep some women from working and going to school, and you don't have to suffer, and you don't have to put your life on hold. Contact your healthcare provider if you have painful periods, and it may be helpful to keep track of your periods and the days on which pain is the worst, so you can make a complete report. And if you notice other symptoms like headaches or heavy flows, you should keep track of those too. And your provider will probably ask you when you started getting your period, how long they lasted, if you are sexually active, or if other women in your family have problems with their periods and what kinds of treatments you might have tried already. And another note is to remember that menstruation is normal. You might get cramps, but you don't have to suffer silently with them. There are ways to make the painful periods less painful, so make sure you talk to your healthcare provider about all that. So I hope this was helpful. Thank you for joining me for today's episode. Remember, a like is always appreciated, and I have a disclaimer that the video content on this channel is for educational purposes and not intended to be a substitute for professional medical advice, treatment, and always seek the advice of your physicians or other qualified health provider with any questions you may have regarding a medical condition, and never disregard a professional medical advice or delay in seeking it because of something you read or have seen on this YouTube channel. And I hope to see you in our next episode. I wish you good health. Bye bye, and see you soon.